2026.
Marketplace Morning Report is next, and later on Morning Edition at the annual U.S. Conference of Mayors this month in Washington, D.C., Republicans were among those expressing concern about ICE tactics and calling for a de-escalation in Minnesota. We'll have more on that in about 15 minutes. 13 with clear skies out there, sunny, and 21 for a high today, feeling much colder than that. Cold again tonight. Tomorrow, sunny and cold, a high near 17, but feeling much colder than that. And then on Saturday, mostly sunny with a high near 20 with a slim chance of snow at night. And then on Sunday, a slim chance of snow, mostly cloudy and a high near 23. Monday, we hit the freezing mark.
We're on government shutdown watch with the deadline less than 2 days away.
Marketplace Morning Report is supported by GEP. With GEP Key, Agentic AI, and GEP Smart Software, GEP is at the forefront in agentic procurement orchestration and autonomous supply chains. And by Schwab. Schwab offers investors choices like full-service wealth management, self-directed investing options, and trading on Thinkorswim. More at schwab.com.
I'm David Brancaccio in Los Angeles. Published reports today suggest that Democrats and President Trump are moving closer to a deal to avert a partial government shutdown starting the stroke of midnight Friday to Saturday. Democrats are pushing reforms for immigration enforcement. Marketplace's Nancy Marshall-Genzer has an update.
The final 6 spending bills needed to fund the federal government are packaged into one big measure. One of those bills would fund the Department of Homeland Security, which includes ICE. In his speech on the Senate floor yesterday, Senate Democratic leader Chuck Schumer called on Republicans to split off the DHS bill so the Senate can pass the other 5 spending bills and send them on to President Trump for his signature. The New York Times is reporting that Schumer and Trump are talking about a deal that would separate the DHS bill as Schumer requested. Then the Times says Congress would vote on a short-term extension for DHS. That would allow time for more negotiations on changes Democrats want for ICE. Among them, ICE agents couldn't wear masks and would have to wear body cameras. They would also have to stop making arrests and entering homes without warrants. But all these changes would also have to be approved by the House. I'm Nancy Marshall-Genzer for Marketplace.
Let's do the numbers. Up music. S&P and NASDAQ futures are up by less than 0.1%. Dow futures are up 0.5% at this point. The 10-year interest rate steady this morning so far, 4.25%. After the Federal Reserve yesterday, no surprise, decided to keep its interest rate steady. Fed Chair Powell seems in no rush to lower rates anytime soon, given tentative signs that the U.S. economy may be healing. Crude oil traded in New York is up 2.2% to around $64.50 a barrel now, but the European price, Brent crude, got very close to $70 a barrel for the first time since September. This after President Trump told Iran to make a nuclear deal or face military strikes.
Marketplace Morning Report is supported by Odoo, dedicated to providing software designed to scale with businesses. Odoo's programs for manufacturing, accounting, and more aim to provide building blocks for creating a custom software suite. Odoo, what businesses need. And by Progressive Insurance. The Name Your Price tool provides a range of coverage options. Progressive.com. Price and coverage match limited by state law.
Now to the many effects of President Trump's executive order from a year ago aimed at ending gender-affirming care for transgender people under the age of 19. The administration has since launched investigations of several hospitals. And last month, the Department of Health and Human Services proposed a rule to turn off Medicaid and Medicare funding for hospitals that deliver that care. Now, that rule is not yet in effect. Some states have sued. All of this is taking a big toll on transgender young people and their families. And as Marketplace's Samantha Fields reports, it's also taking a toll on healthcare providers.
Even though the new rule is not in effect yet, a number of hospitals around the country have already stopped offering gender-affirming care to minors, including 2 in Colorado, Children's Hospital and Denver Health. Casey Cash, a family nurse practitioner in Fort Collins, was on vacation with her family for the new year when the news broke.
My phone blew up at 8 a.m. And that's how I found out. And I was like, what are you talking about? What do you mean Denver Health? What? Children's? No. What?
Cash is not affiliated with either hospital. She and her longtime colleague, Dr. Stacy Johns, just opened a nonprofit primary care practice in November called the Iris Center. Among the services they offer is gender-affirming care, including for kids and teenagers, which is backed by major American medical associations. That can include prescribing puberty blockers or hormones. At their practice, it does not include surgery. John says they knew local hospitals might stop offering transition-related care to kids at some point because they can't afford to lose Medicare and Medicaid funding, but they didn't think it would happen so soon.
We thought we had at least till April.
Instead, they only had until January 2nd, a Friday.
I think that Monday we were getting an average of about 20 requests an hour of people calling us.
Specifically, parents looking for providers for their trans kids. Before, Cash says they might have gotten that many calls a week.
We have been really overwhelmed by parents of children under the age of 18 who are no longer feeling safe to get care.
Cash and John's practice is not specifically for gender-affirming care, but they offer it. And John says in recent days, they've been doing a lot of triage, trying to help as many transgender kids as they can get the care they need.
But we are only two people, and we are primary care. We have a lot of patients that are cisgendered and also need care. So kind of balancing the need of all of our patients has been challenging.
It's also just a challenging time to be a doctor or nurse caring for trans kids in this country. 27 states have banned transition-related care for minors in the last few years. Some providers in those states have uprooted their families and careers to move to places where they can still practice. And now, even in states where it is still legal to offer that care to kids, a growing number of hospitals are shutting it down, at least temporarily, over investigations and threats from the Trump administration.
Emotionally, providers are distraught.
Dr. John says everyone she knows who does this work cares deeply about their patients.
And to have to be forced so abruptly to abandon them is really devastating to a lot of them. And a lot of them have their own fear about what's going to happen to them as providers.
Fear about whether their employers will continue to support them, fear of losing their jobs, fear of being targeted by the administration. But Cash says they're also committed to continuing to support and care for trans kids.
It is amazing to watch the progression of a child who didn't make eye contact finally sit up, smile, push their hair out of their face, tell me about band that they joined or whatever. And it is, I get goosebumps. I have goosebumps right now.
It is the most rewarding work she's ever done in more than 20 years in medicine.
There are a lot of providers that are desperate to continue this care, and they want to because we know it saves lives.
Cash says she and Johns have been hearing from lots of providers who are working hard to find ways to keep offering it. I'm Samantha Fields for Marketplace.
The new tax-favored investment vehicle for babies born in this presidential term, Trump Accounts. The Marketplace Morning Podcast will have a closer look if you missed it on the air. It's the Morning Report from APM, American Public Media.